New York's Governor Kathy Hochul has announced a mask mandate which will require masks to be worn in all indoor public places in New York unless a business implements a vaccine requirement. This measure has gone into effect in order to curb the spread of the virus during the holidays when more time is spent indoors shopping and gathering. In fact, nation's leading health expert Dr. Anthony Fauci has said that he also strongly urges people to wear masks whenever they are indoors when other people's vaccination status is unknown. While 80% of New Yorkers are fully vaccinated, the state has been seeing a recent surge in the spread of the virus, especially with the new concerning Omicron variant of the coronavirus. Focus still across the nation remains on getting more Americans vaccinated with the first dose or with the booster, and experts are pleading all to get the COVID-19 vaccine and help come over this deadly pandemic. So again, as stated on our show before, you can visit vaccines.gov for all information on the COVID-19 vaccine and locations to get appointments. On this and much more, we spoke with Dr. Rachana Kulkarni. Here is Dr. Kulkarni. So from a cardiology perspective, how are you looking at people that have heart issues? And there's a lot of members of our community, doctor, that actually fall under that category. How many patients are you seeing with that? And the patients that you have, how concerned are you about them?
Very concerned. You raise a very good point that people with heart disease are at high risk for COVID-19. And the reason is that heart disease comes because of multiple risk factors, which are very prevalent in our community, such as diabetes, high blood pressure, truncal obesity, hyperlipidemia. All of these are extremely prevalent in South Asian communities. And as a result of that, heart disease is also very prevalent in South Asian communities. When we have that, that becomes kind of a perfect storm for COVID-19 infections. So getting yourself vaccinated and especially getting yourself boosted is very important.
Right.
And
go ahead.
And you raised a very good point about holiday gatherings. So if I can take a moment to talk about what to do. With holiday gatherings coming, we all are going to get together with our families. And I would like to take a 3-step approach. Get the booster before you decide to attend a holiday gathering, because give yourself that extra margin of safety. We are noticing that the immunities are going down. So getting boosted is the only way you can consider yourself fully vaccinated before attending the meeting. On the morning of the meeting, you should take and pass the rapid antigen test. You don't have to go to a facility. There are now rapid antigen tests which are available at Walgreens or CVS. Get them and pass them, because you're going to meet your loved ones and you want to protect not just yourself, but them as well. And third thing is, if you're not feeling up to it, and if you're feeling sick, don't shy away from saying, I'm not feeling well, I can't attend. If you take these 3 steps, then you should be able to attend and enjoy the family gatherings.
And those steps are, again, very important. And vaccines.gov is the website that everyone can go and find more information on the COVID-19 vaccine. We were talking about heart and the cardiology perspective here. I have to ask you on that, another big question that's concerning parents nationwide. We're seeing lack of vaccinations amongst children because of that. This fear of this heart inflammation disease that is being seen as a reaction to the COVID-19 vaccine amongst the younger generation. I need to know from you, how are you looking at this, and how dangerous could this heart inflammation be?
There have been reports of myocarditis after the second dose of the vaccine. It's also more prevalent after the second dose in young males. So I understand the reason for concern, but let's not forget that if kids or young adults don't get vaccinated, and if they do get COVID also have long-term ramifications of cardiac issues, it could be myocarditis, it could be inflammation of the heart muscle or the sac that holds the heart. We also know that other than cardiac, there will be other side effects or long-term effects of COVID, including neuropathy, fatigue, heart blocks, all of that. So when you take all of that into consideration, the benefits of COVID-19 vaccine outweighs the risk of myocarditis, as the prevalence of that is very, very small.
Yeah. And is it easily treatable, doctor?
It is. And the most of the time, the
Right.
treatment is symptomatic. And the good news is that most people recover from myocarditis without any residual effects. We cannot say the same thing about COVID 19 long term effects. So I still think it's an American Association of Pediatrics also recommends COVID 19 vaccine because the benefits outweigh the risks.
Yes. So do you think they would be eventually pushing boosters for even young children ages 5 to 11 because they are getting a smaller dose of the vaccine to begin with, doctor? So how would that be evaluated?
If I have to project and speculate, when I'm seeing the trends, I would say that the boosters for younger kids also should be coming soon. And we have seen that in a lot of other infectious disease cases. Uh, Most vaccines that the kids take do have boosters. So I would think this vaccine also will follow the same trajectory.